70% of North Koreans are food insecure, and half of them are malnourished. If you look at the stunting rates, 30% of children under 5 are stunted. This is a significant problem. That subjects the population to diseases that are opportunistic, such as tuberculosis.
Neurosurgeon Key Park of Harvard University is one of only a few American doctors granted regular access inside North Korea. Obtaining an accurate picture of the health situation in the DPRK is exceedingly difficult, given the government's extraordinary secrecy and the heavy restrictions that limit foreigners' ability to venture outside the capital of Pyongyang, home to the nation's ruling elite caste. Still, the numbers are alarming. According to the World Health Organization, the country's tuberculosis rates are some of the highest in the world and tower over the bordering nations of South Korea and China. And groups on the front lines of treatment estimate that some 16,000 North Koreans are infected with a highly dangerous strain of the disease, multidrug resistant tuberculosis, or MDR-TB. Only 2,000 MDR-TB patients, however, are being treated nationwide. Park and other experts are convinced that cases of MDR-TB in North Korea, which are already among the highest in the world, could spiral out of control and deliver a disastrous blow to the country's impoverished rural majority and neighboring Chinese and South Korean populations.
When you leave a country with a limited stock of medications, the natural tendency is to start rationing out the drugs. When you do that, that's when multidrug resistant TB starts to increase in numbers. So we will see an explosion of MDR-TB in North Korea. It's almost certain, and it's a huge public health concern.
The Center for Strategic and International Studies Commission on Strengthening America's Health Security produced this documentary. Among the Commission's priorities is spotlighting the health security dimension of geopolitical flashpoints. Recently, the world's attention is focused on the historic talks between President Donald Trump and North Korean leader Kim Jong-un, and the hope that the DPRK's nuclear weapons program could be dismantled and comprehensive sanctions lifted. But just below the surface is North Korea's health crisis, which is seldom discussed. The fate of the country's most vulnerable populations does, however, remain a vital concern for humanitarian and medical experts, including World Food Program Director David Beasley. He recently visited the interior of the country to see firsthand the realities there.
There's malnutrition, chronic malnutrition. They don't have the vitamins and the proteins and the micronutrients that they need. And they have harsh winters, and they have either droughts or flooding in the springtime. So only 15 to 20% of their land is actually arable.
Exacerbating the malnutrition is a chronic lack of clean water and sanitation. According to UNICEF, more than a third of household drinking water is contaminated, and the health of 90% of the rural population is threatened by unsafe disposal of human waste.
Another startling dimension is the advanced decrepitude of the health system itself. Chronic stockouts of medications, technology and training that lags years and if not decades behind. In combination, these stark realities create deep vulnerabilities.
Given how fragile life is for the rural majority, internal or external strife could suddenly trigger breakdown and mass flight.
When we look at this country and we think about what could happen, there's obviously concern about war, there's concern about implosion because of coups, elite on elite coups, military versus party. What people don't really think about is the possibility that there could be some major breakdown of order inside the country because of some pandemic or some health crisis. Their health infrastructure cannot handle this. If something like this were to happen, I don't think their security infrastructure is ready to deal with mass migration or mass violence as a result of a major health crisis.
I think both South Korea and China are concerned about that implosion of the humanitarian situation, particularly if there is a regime instability, or let's say there's a regime collapse, or even something that happens militarily between the United States and North Korea. In any kind of contingency scenario, all these North Koreans are going to flee North Korea.
For the Chinese, this is their worst nightmare. You know, thousands, if not millions, of North Koreans that have diseases coming across the border and trying to find help in the largely ethnic Korean province of Jilin, where they would be very difficult to find relative to other ethnic Koreans who are already living in Jilin province.
The extreme deprivations and the lasting legacy of the late 90s massive famine, experienced daily by the rural majority, have deep roots. Most fundamentally, they are the legacy of decades of brutal malgovernance, repression, and denial of basic rights.
People were assigned to a kind of caste system.
Michael Kirby, a former High Court Justice of Australia, was the lead author of a monumental 2014 study of North Korea's human rights, commissioned by the United Nations.
The people who got the food and the people who got the jobs and the privileges and, in rare cases, access to the internet and other overseas information, they were people in the top sector of Songbin, and the people who were not trusted were down at the bottom, and it was very difficult for them to escape. This is a medieval form of organising society, but it still exists in North Korea, and it is still relevant to access to food.
The rural majority suffered massively in the late 1990s famine. Upwards of 1 million or more North Koreans died. Many of the millions who survived were permanently damaged. They and their next generation still struggle to recover. Desperation did, however, open the door to the outside world.
In the worst of the famine in the mid-90s in North Korea, the ambassador to the UN up in New York literally started cold calling NGOs to see who could be responsive.
The famine arose in the midst of multiple natural disasters and the end of the Cold War and the Soviet Union itself.
Hereby discontinue my activities at the post of President of the USSR.
They were doing relatively well until the collapse of the Soviet Union. They lost their client state status, and then that was exacerbated by the droughts, by the floods, by the poor agricultural production.
In recent years, North Korea has made some gains with the help of expanded programs by UN agencies and non-governmental groups, with a special focus on MDR-TB, hepatitis B, malaria, nutrition, sanitation, immunization, and women and children. U.S.-based groups, including Christian Friends of Korea, have persevered over many years and made substantial contributions. International partners, including Gavi, the Vaccine Alliance, have propelled much wider immunization coverage over the past decade and a half. This, in turn, has dramatically lowered mortality rates for mothers, children under 5, and newborns. The recent UNICEF report documents that the overall stunting and malnutrition rates have declined since 2009. And while that number is positive, that masks continued exceptionally high rural rates.
We can see there are differences between urban and rural settings. So, for example, in the case of urban Pyongyang, the city capital, the rate is as low as 10%. And out in rural Rangyang province, the rate is as high as 32%. We also have data that can help us do a deeper analysis to find the children to focus on. And in the case of stunting, we know that 4 to 5-year-olds, the case of stunting in poor households is as high as 40%. So again, we can see we're making great progress. We know the interventions and the programs that can bring change to children. And now the data shows us where we haven't reached children yet, and therefore where greater effort is needed.
Recent health gains and expanded health programs, however, are at grave risk in the face of the historic confrontation over North Korea's nuclear weapons and missile program.
North Korea's accelerated acquisition of nuclear weapons and a missile delivery system triggered multiple international sanctions out of a recognition of the strategic threat that North Korea now poses. Whether inadvertent or not, this maximum pressure approach has harmed existing health and humanitarian programs, even though those programs are exempted from sanctions. Donor commitments to UN health and humanitarian programs have dried up.
We're having now to cut back programs that we were able to work at the local level with children in schools and pregnant women. We're now having to eliminate many of these programs and reduce our support to rations only to the youngest of children between 0 and age 3, the first 1,000 days, and to pregnant women. These are very important years. If the children don't receive the support they need these first few years, it's not just a physical impact, but it also is a mental, cognitive impact.
It's really not the people's fault that the current sanctions are being applied, but they're the ones that are being impacted the most.
Efforts to sustain North Korea's public health improvements were dealt a public blow earlier this year when the Global Fund decided to close its 3-year, $44 million tuberculosis and malaria program.
It did that because it was worried that it could not guarantee the accountability of those programs. It could not ensure the donors that there would be no diversion by the regime of critical commodities, particularly in tuberculosis, to elites or to militaries and away from the intended beneficiaries. The consequences of a decision like that is you create uncertainty over how are you going to continue to serve the needs of the 120,000 people who are already on tuberculosis therapy. And there have been efforts made to stockpile supplies so that those programs can continue for the next year. But there's still uncertainty, there's risk of interruption. And you're not going to see any expansion to fulfill the other unmet needs in the meantime. And then with regard to malaria, whenever you interrupt treatment and prevention programs, malaria tends to come back very, very rapidly. And we can expect to see that in North Korea.
The stakes for North Korea's impoverished majority are enormous. So long as comprehensive sanctions remain in force, international programs of support and health remain on the block, their future viability completely in question.
North Korea remains a geopolitical flashpoint, and its internal health security vulnerabilities make it a tinderbox. It leaves it open to internal implosion and for export of its problems into the surrounding region.
It's not just the community and the village that pays a price. The country and the region and the world pays a price.
If talks advance, however, that might ease humanitarian access and create a pathway for expanded action by UN agencies and international NGOs to help curb North Korea's health threats and alleviate suffering among its population. It might also open the way for cooperation in applied science and research, focused on North Korea's exceptional needs.
I think it's certainly possible, in part because if the nuclear negotiations move forward, the North Koreans will want some sort of sanctions lifting. It's very difficult under the current circumstances to remove 10 UN Security Council resolutions and countless other sanctions individually that countries have put on North Korea. However, the most practical place is to basically enlarge the humanitarian exception to the UN Security Council resolutions. And that's, I think, where we would see the first and the best opportunity, at least, to improve access.
Well, I think that it's enormously valuable to look at health and science as a tool of diplomacy and a set of issues and outputs that cut across borders, cut across ideologies, cut across politics in ways that can really bring people together, can benefit all and can build new bridges of trust and confidence. Health is a universal value. There is no culture or society or community on earth that doesn't care about the health of their families, their own health, the health of their communities.
There remains a question, however, about what should be done on the health and humanitarian fronts if talks fail. Under that scenario, outside powers will be left with very hard choices.
It's a difficult and complicated story, but there are young children starving and there are people dying for want of essential medicines, and I think it is the duty of humanity to step in, because these people are, in all truth, victims. They are victims of their own government and of their own system of organisation, and they haven't really risen in rebellion because it's so desperately dangerous for them to do so. And therefore it would be inhumane of the international community to just wash its hands of the obligation of giving humanitarian assistance. But that doesn't mean that the sanctions that have an impact on the lives of ordinary people and even on the elite in North Korea should be removed until there is a package that removes the nuclear weapon danger and enhances the protection of human rights and transparency in the response that has to be given for human rights in North Korea.
Far more can and should be done. There needs to be intensified outside pressure on the North Korean regime to permit the UN and international NGOs far greater access to monitor their programs and guarantee their accountability. And secondly, the US and major donors should redouble their commitments in health and humanitarian programs. They're legal, legitimate, and essential. We should do everything in our power to ensure that the UN and international NGOs are able to fulfill their missions. Third, we should begin planning strategically now for the future when it will become possible to expand programs in agriculture, in basic health capacity, in immunizations and infectious disease control. As part of that, we should also begin applied research that will help inform these future decisions. We cannot afford to delay. We need to act now.